Hello to all my dear students. Once again welcome you all to Sail to MDS Dental Academy. We are here with the part 3 discussion with the important concepts of the HPSC Past Papers. So aspirant, let's start with the today's video. So first question of today's video is the absence of which layer of dentin predisposes the dentin to internal resorption by cell of the pulp. It is the absence of predentin. What is a predentin? It's a layer adjacent to the odontoblast layer in the pulp. It always remains unmineralized. If that layer is not there, your dentin will get resorbed. Then the question 2, which of the following is the most accurate definition of a phoenix abscess? So let's see what is phoenix abscess first. It is an acute inflammation superimposed on an existing chronic lesion like your cyst or granuloma. So the correct definition is an acute exacerbation of a chronic apical periodontitis. Etiology is simple. When state of equilibrium in granuloma or cyst is upset by influx of bacteria or necrotic product of high virulence and antigenicity and lowering of host defenses. And second is mechanical irritation during your endodontic therapy. Now aspirant, imagine a patient is there with acute periapical abscess. So which of the following tests could have a positive response? That is your percussion. What is the ideal amount of dentin required between an amalgam restoration and the pulp for insulation? The answer is 2 mm. Remember, for other material you can write 1 to 1.5 mm, but amalgam is a very poor thermal insulator. That is why a base of either calcium hydroxide or zinc oxide eugenol is placed under amalgam restoration to provide thermal protection to the pulp. Then delayed expansion of amalgam is more likely to be associated with which factor? It is associated with the contamination of the amalgam by moisture during trituration and condensation. And this is also one of the principal cause of failure of amalgam. Then which tooth requires special attention when preparing the occlusal aspect of restoration? That is your mandibular first premolar. So whenever you are preparing it, the burr should be tilted lingually to prevent encroachment on the facial pulp bond and also to maintain dentinal support of the lingual cusp. So when you remove caries, which of the following layer of dentin are affected but not infected and therefore no need to remove? That is your transparent dentin, a very confusing MCQ aspirant. So let us make it clear. What's the difference between first infected and affected dentin? Infected dentin has a bacteria, affected dentin has no bacteria. Infected dentin is irreversibly denatured, wherever the affected dentin is reversibly denatured. Infected dentin cannot be remineralized. That's why you need to remove them. Whereas affected dentin you can remineralize. So what are the zones of infected dentin? Zone 4 and zone 5. Name should be remembered: turbid zone and infected dentin. Where affected, you have zone 2 and zone 3. Zone 2 is a subtransparent and zone 3 is a transparent dentin. And also remember aspirant, in a chronic or slow caries, infected dentin is usually discolored. And because the bacterial front is close to discolored front, it is advisable in caries removal to remove all discolored dentin unless it is within 0.5 mm of the pulp. In acute caries, the discoloration is very slight and the bacterial front is well behind the discoloration front. So some discolored dentin may be left, although any clinically remarkable discoloration should be removed. So this will solve the confusion between infected and affected dentin. Now aspirant, 8th question of the day. The initiation of dental caries require a high proportion of which bacteria? That is a Streptococcus mutant within dental plaque. Now a case report. Imagine you are inserting crown and you notice the margins are open when you try to sit the crown in mouth. So what you will check first? You will check the proximal contacts. Then a sedative often used in management of anxious pediatric dental patient, that is chlor hydrate. The best is your midazolam. So chlor hydrate is used to calm your child or help her to fall asleep. This can be because the child may be feeling anxious or having problem falling asleep, or child may be going for a medical procedure. Now, which antibiotic is not only effective against most staphylococci, aerobic and anaerobic streptococci, but is also effective in treating infection due to bacteroid species? So here the antibiotic of choice is clindamycin. Now dry sterilization question. So if you are doing dry sterilization at temperature of 160 degrees Celsius, so how much time it will take to sterilize your instrument? It will take around 120 minutes. Then which type of pathogen provide the ultimate test for efficacy of sterilization? That is spore forming. It's the spores of Bacillus stereothermophilicus. Even you can remember the strain, that is a ATCC 7953 or CIP 52.81. Now a community question. The proportion of existing cases of disease in a population at one point in time or during a specific period. So whenever the one point and specific period is there, it is the prevalence type of study. Now accurate is there to scale and root plan anterior teeth with deep pockets. So when you are going for planning of anterior teeth, remember you require a long and straight shank. Pleasure concept is associated with what? It is associated with the lingualized occlusion. Let us understand pleasure concept in simple manner. So in 1937, Dr. Max Pleasure described a reverse occlusion scheme in which posterior teeth are set with buccal teeth, providing total lever balance during function. So here you can see buccal teeth, reverse curve is given at the premolar. So this is the premolar. No tilt or flat occlusal surface at first molar and a lingual tilt at second molar, and that's our monsoon curve also. Then whenever aspirant you see a discrepancy in occlusion of a denture, how you can detect it? You can detect by remounting procedure of denture. Squint test is used for what purpose? It is used for shade of the teeth. Now let's see little detail regarding squint test. Remember, it helps in evaluating colors of teeth with the complexion of the face. So how we do squint test? With the eyelid partially closed to reduce light, the dentist compare prospective color of artificial teeth held along the face of the patient, and the color that fades from the first view is the one that is least conspicuous in comparison to the color of the face. Now aspirant, last question of the day. So functional cusp bevel in the preparation of a tooth for a full crown or FPD provides what? It provides bulk of restoration for strength. We know for the maxilla the functional cusp is palatal and for mandible it is buccal. So what it provides? It provides the bulk aspirant. As a part of occlusion reduction, wide bevel should be placed on the functional cusp of posterior teeth. Rounding help in bearing high stress in this area. Mandible, facial cusp, paralleling the inclination of the cusp plane, it opposes, and maxilla we have lingual cusp. So aspirant, that was all for today's lecture. If anybody want to join the government dental exam test series for the HPSC or NEET MDS test series, they can contact me in the details given on the screen, and also the information is given in description box. Till then aspirant, take care. See you soon with the part 4.